Dr. HALIL RUSO, welcome here with us.
Thank you. Thank you very much.
The second annual Congress of MSERM in the beautiful city of Fez in Morocco. So you are director of IVF labs in Kurgan IVF Group. You're also part of the Department of Histology and Embryology in Gazi University Faculty of Medicine.
Yes.
So I know that you've come here to join the Congress to maybe meet other experts. You've given lectures yourself.
Yes.
And so what I would like to ask you today is what you could tell us about the current status in male factor infertility.
First of all, thank you very much for the organizing committee to be invited here. I'm so happy. Yeah, it's quite vibrant and energetic. I love the people, so I feel quite welcomed as well. And thank you very much. So, male factor infertility, you've been asking? Yeah?
Yes.
Yes.
Absolutely. What's the current
status?
The
current status is actually, we don't really know much. That's the problem when it comes to male factor infertility. The research been done and the answers we got from male factor infertility is quite limited. But we know for sure that male factor infertility is on the rise. The sperm counts of men in general in the world is on the decline. So that's one thing quite sure, that there's a big problem in male factor infertility, and there are bigger problems to be seen in the future as well, in my own opinion.
Okay. Did they go through the causes? I mean, is there studies that
yeah, there are many causes, but it's mostly unexplained. We don't know why the sperm counts are declining in men. And apart from reproductive health, it's a general health problem as well.
Yes.
Because a male's ability to produce sperm is also representative in general health as well.
Yes.
So we can say that both the reproductive health and the general health of males are on the decline. I think it is safe to say that one as well.
Okay.
Just to raise awareness, males are not so keen to go to urologists, specialists to seek.
Get checked.
So, yeah. When compared to females, females go to the gynecologist for yearly checks, for swabs and everything, but males don't do it. I don't know, it's kind of a taboo in general public, let's say. So I would advise for men to be not too shy when it comes to healthcare problems, especially reproductive problems, to seek advice from their peers and to seek advice from specialists as well.
Yes.
I think it would be wise for men to check, even though they are not interested in having a baby, even though they are not married. I would advise males to go and check their sperm counts to identify any upcoming problems beforehand.
That's
and
good
seek
to know.
advice. Yes.
Perfect. So in general, what would be your message for couples who would like to take care of their reproductive health?
First thing is that don't make it a taboo. I mean, it's a problem that is very common at the moment. When it comes to male factor infertility, we see that it's around 50% of the cases of infertility is coming from the male side. Normally, it is mostly believed, especially in Eastern cultures, that is mainly the female problem.
Yes, yes.
I don't agree with that. Yes, it's not true. It's far from truth. Men are experiencing, as I said, decline in sperm counts, decline in their fertility
Maybe
potentials,
also
sperm quality too as well. It's also included in there. And even though if it is appearing normal in everything, the count is normal, the motility is normal, they might be dysfunctioning. And it is almost impossible to know if there's any dysfunction just by looking at the spermiogram. So, but this is what we have at the moment to check the reproductive health of a male, and also it can be indicative of general health. So I would advise the couples to seek help, not to be shy about it, and to just go to the doctor and have their semen examined in WHO standards. We got a manual that is published very recently from World Health Organization stating that these are the procedures should be undertaken to see if a man's sperm sample is normal or not. So I would advise males to check for IVF laboratories or andrology laboratories if they are following WHO standards, and opt out for those centers
Yes,
to
and
check their semen parameters.
maybe also like be careful with their general health, as you said.
Exactly.
It's also related to their
Exactly.
general health, so it's lifestyle and everything
Exactly.
else.
Exactly.
Okay,
Exactly.
that's perfect. Well, thank you so much, Doctor, for
It was my pleasure.
being here with us and answering our questions. And we hope we'll see you again in our
Hopefully.
next annual
Looking
Congress.
forward for that.
Thank you. Welcome again.
Thank you very much.
Morocco.
Thank you very much.